If a patient is extubated and experiences loss of kidney function, is this from fluid overload? If you want to know the answer to that, stay tuned. My name is Patrick Hutzel from intensivecarehotline.com, and I have another quick tip for families in intensive care. So today I have this question from Lena, who says, "Hi Patrick, if a patient is extubated and experiences loss of kidney function, is this from fluid overload?" So let's dive into the answer of that question. So first of all, let's clarify some terminology. Extubation means the removal of the breathing tube for a patient in intensive care. So that's what extubation means. Someone has been weaned off the ventilator successfully. Now they're ready to have the breathing tube taken out. Now, so loss of kidney function following extubation can potentially be related to fluid overload, but it's not the only possible cause. After extubation, patients are at risk of various complications, including fluid imbalance, which can occur to several reasons. Fluid overload: if the patient was on mechanical ventilation for an extended period, they might have received significant intravenous fluids, leading to fluid retention, right? This could result in kidney dysfunction, especially if the kidneys are unable to excrete the excess fluid due to the underlying renal issues. Next, pre-renal causes. Reduced renal perfusions due to hypotension or poor cardiac output after extubation can also impair kidney function. Next, renal injury. Other causes such as acute kidney injury, AKI, from ischemia, sepsis, or nephrotoxic medications may also contribute to the loss of kidney function. And lastly, electrolyte disturbances, abnormalities in electrolytes or acid-base balance can impact renal function as well. In any case, careful monitoring of fluid balance, kidney function, especially creatinine, urea, BUN, urine output, and overall clinical status is crucial, absolutely critical in such places. Now, the biggest cause that I have seen, after having worked in critical care nursing for 25 years, that patients go into acute kidney failure is really sepsis, hypotension, and mismanagement of fluid balances, but also electrolyte disturbances, and hypotension, and also rhabdomyolysis, which is not mentioned, which I haven't mentioned yet, which is when patients have multiple trauma and the body is breaking down the muscle tissue and then is released into the body, and that can clog basically the kidneys as well. But the procedure, extubation as such, is very unlikely to cause kidney failure. It's more what's leading into it. And when you look at the research, and I don't have the numbers right here, but there's a reasonably high number of patients in intensive care that go into kidney failure for the reasons that I mentioned. And those patients may not necessarily be intubated. It all comes down, once again, what happens in intensive care is often patients are septic. That can cause kidney failure. Patients might be hypotensive for significant periods of time, and that causes a lack of organ perfusion, including lack of kidney perfusion, and that can cause kidney failure, sometimes temporarily, sometimes permanently. You have to discuss that obviously with the intensive care team if that's the situation with your critically ill loved one. So I hope that answers your question. Like I mentioned, I've worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years in intensive care. And I've been consulting and advocating for families in intensive care since 2013 here at intensivecarehotline.com. And I can very confidently say that we have saved many lives with our consulting and advocacy. And you can verify that on our testimonial section at intensivecarehotline.com. And you can also verify it on our podcast section at intensivecarehotline.com, where we've done client interviews who can verify that we have saved their loved ones' lives. And that's why we have helped hundreds and hundreds of members and clients over the years, and we can help you as well very fast. You will be surprised how fast we can help you when you have a loved one critically ill in intensive care, because the biggest challenge for families in intensive care is that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. That is exactly what you are up against if you're watching this. And that's also why I do one-on-one consulting and advocacy over the phone, Zoom, Skype, WhatsApp, whichever medium works best for you. I talk to you and your families directly, I handhold you through this once in a lifetime situation that you simply cannot afford to get wrong. And when I talk, and I also talk to doctors and nurses directly with you or on your behalf. And when I talk to doctors and nurses directly, I ask all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. And I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. We also have a membership for families of critically ill patients in intensive care, and you can become a member if you go to intensivecarehotline.com. If you click on the membership link, or if you go to intensive care, intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in the membership area and via email, and we answer all questions intensive care related. You also have exclusive access to 21 ebooks and 21 videos that I've personally written and recorded. And all of that will help you to make informed decisions, have peace of mind, control, power, influence, so that your loved one gets best care and treatment always. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have. Share this video with your friends and families. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notified for the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to my intensivecarehotline.com email newsletter. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.